Hello there, my name is Ash Us, and I am the Advocacy and Partnerships Coordinator at Andre House of Arizona. Andre House is a basic needs center for people who are experiencing homelessness in Phoenix. Every day, we open our doors and provide things like clothing, hygiene supplies, blankets, and most importantly, hospitality to people who are on the streets in Phoenix, Arizona. On any given day, we serve between 450 and 500 meals to people in our community. Not all of the folks who come into Andre House are currently experiencing homelessness. In our most recent demographic survey, we know that about 50% of the people who come into Andre House are sleeping on the street at night. We also know that about 30% of those individuals are currently working and employed. The remaining individuals are staying at CAS, which is the shelter located across the street at the Human Services campus, and a small portion of the people who come in for our services are currently housed and just in need of a little bit of help to get by. I've been at Andre House since 2017. I moved from New York and then Boston, and from Boston to Phoenix to become one of the year-long volunteers at Andre House. Andre House is a unique place in the sense that the basic services are operated by 5 to 7 folks who are fresh out of college or in some cases even at a later stage in their life. And they commit to doing a year of service and living in intentional community with one another. During that year, you eat all of the food that you serve at Andre House. You get your own hygiene and clothing and basic needs supplies from Andre House as well. And you receive a $200 a month stipend in exchange for your service. This was really where my experience with homelessness started, at least at the professional level. In the year that I spent doing a year of service with Andre House, I was so privileged and fortunate to get to know hundreds of people who came in as people needing a blanket or a toothbrush, people who would come in every day, people who I would build meaningful relationships with. At the end of that year, I found myself really rattled by a lot of the things that I had seen. The most frustrating part of that experience for me was seeing how difficult it was for the people coming into Andre House to end their homelessness. People have so many barriers that lead them to being on the streets in the first place. And I observed how all of these barriers intersected and often compounded one on another and made it just increasingly more difficult for people to get off of the streets. I personally knew about some of these barriers. My initial call to homelessness was really from my own experiences as a young adult. My mom and I fell on some tough times, and I was so fortunate to never have to spend a night on the street. We had people who could take us in. We had an awesome St. Vincent de Paul who was able to provide us with services. And because of that, I was able to get a little bit of help, go on to college, and move forward with my life. But every day that I was at Andre House, I would meet countless people who had just been dealt one bad hand after another. People who, despite trying as hard as they possibly could, they would wake up each day to encounter a new obstacle that would make it more difficult for them to exit homelessness. One of my more impactful and earliest experiences was with one individual that I knew very well. And this was an individual who had been experiencing mental illness all of his life, through his childhood and into his adult life. And he was someone who, when medicated, could work and thrive in any traditional environment. He had multiple professional experiences in great jobs. He had family, he had children. And he went through one experience of loss. He lost someone in his family, he stopped taking his meds, and he quickly spiraled. For a lot of you all who are watching this and people who work in homelessness, we know that this isn't a unique thing. We know that all it takes sometimes is one really bad thing to happen to set someone back or to delay the process of them getting the help that they need. With him, I think that was one of the more impactful experiences because he was someone that I'd come to know so well. We only got one day off a week when I was on the core staff, and a lot of times I'd spend my day with him. I'd pick him up in the zone, and we'd go to McDonald's and hang out. he became a friend of mine, and it was just really difficult to see all of these different systems fail him. He wasn't eligible for certain benefits because he worked, but if he worked, he couldn't work more than what he was currently working because of his disability, and disability wasn't enough for him to secure his own housing. So that was just kind of, for me, one of the first times that I found myself really caring for someone and realizing that no matter how much I cared and no matter how much all of the great people working at the Human Services campus or at Andre House cared, there were certain just systems that had failed him. I bring this up because these were the kinds of things that I was experiencing and thinking about and reflecting about very critically before there was a global pandemic. And I don't know about any of you, but I am surely ready for 2020 and this pandemic to be a thing of the past. But COVID has obviously made things far more challenging for the people that I work with and for the people that I know here in Phoenix. When the pandemic really started and became a serious problem, we were fortunate in Phoenix that, unlike other cities that were limited because of temperature, we could create some outdoor options for folks. And so I saw our county and some of our human services providers and elected officials coming together to create socially distanced spaces to use for people who were positive or for people who would need some sort of isolation. And I felt grateful that we had that. But I think about that time in March and April, and one of the questions that I was asked in preparing for this and in thinking about this conference was, what happened in March and April, and how did COVID impact things then? And I don't know if a lot of you feel this, but that was a time where it really tested not just myself, but all of our staff at Andre House in our ability to be flexible and to respond to crisis. When I was in college in Boston, I had a mentor who always used to talk about this example and tell people to be a duck. And we would look at her like, that was so strange. What is she talking about? But there's this story of how when you look at ducks who are floating on the water, they appear to just be coasting along and floating along the water. But if you were to look at them under the water, they're pedaling incredibly fast just to keep afloat, just to keep moving. That's how Andre House has felt since March. And it makes me sad that that hasn't stopped, but that's how it's been. All of us knew that this is what we had trained for, this is what we had been prepared for, and this is what a lot of us as folks with some sort of lived experience with homelessness or mental health or any combination of things, we know how to be resilient and how to take a crisis and how to respond and move forward. And that's how March and April felt. In Phoenix, we were really lucky. We didn't see a huge outbreak at Andre House in the way that other cities did. I remember talking to colleagues who were in other cities where there were massive outbreaks of people experiencing homelessness who were contracting COVID at an alarming rate, and we didn't see that. And what that tells me is that our protocol really worked. Between the Human Services campus, all of the organizations there, and Andre House, we quickly implemented a lot of protocol to try and reduce the spread of COVID. And whether it was that protocol or something greater than all of us that kept it from becoming a huge outbreak, I'll never know. But right now, I think I'll choose to believe that it's probably a pretty even combination of both, of people trying really hard to reduce the spread and also some sort of good luck or good energy, whatever you believe that to be. One of the main things that I've taken from this COVID experience is really the resiliency of the people that we work with. Providers and people who are in direct service talk about how resilient their clients are all of the time. But I really saw that in March and in April especially. There were a lot of people who used the services at Andre House that had developed great systems for getting their basic needs that they would otherwise not have. There are a lot of individuals who would come in every morning and pick up a hygiene pack and head on over to the public library where they could use the computers, access air conditioning, etc. There were specific restaurants that people knew that they could go to, and if they bought just one thing or said hello to the right person, someone would give them access to a restroom. There were other parts of the city, certain light rail stations where people knew there wouldn't be police officers moving them or forcing them out of the light rail station. People knew about certain parks that would be more secure or private, where they could sleep during the day if they hadn't slept all night. In March and in April, for so many of these folks, these habits, these routines, they became completely disrupted. People could not access libraries, restaurants were closed down. Somehow there were even less access to public restrooms and hand washing stations than ever before. And our guests were certainly stressed by that. We had to make adjustments to Andre House as a consequence, but people were strong. They were resilient, as many of them have had to be their whole lives and figure it out. And what I found, and I'm kind of embarrassed and both humbled to admit it, is that our guests are resilient beyond belief and they could adjust to the changes. It was many of the service providers and many of the people that I worked with who were struggling more to respond to COVID. Because the thing that we forget and don't often speak about with people experiencing homelessness is that for people on the streets, every day is a crisis. Even the people who wave hello to you or come into your case conferencing meetings, or people who show up for your one-on-one and are in great spirits, they're like those ducks in the duck example that I was talking about. They may be friendly and they may be doing well and cheerful, but at the end of the day, there's no part of homelessness that is a normal or healthy situation. People are existing in crisis mode every single day. And the pandemic exacerbated that, but this is a population with a skill set in thriving and adapting amidst such awful and atrocious things thrown at them. So that was one of the major things that I learned. Another takeaway that I think I've learned from this, and I hope that we as a society and a city and even on a more national level can really learn, COVID has taught me to really check my own privilege and the blessings that I have. One of the most common things that happened is that people would come in as soon as we opened every morning and say, my doctor is only doing telemedicine. I'm out of my prescriptions, my psych meds, and the only way that I can get a refill is if I do a telemedicine visit with my clinic. I don't even have a phone. How am I supposed to do that? And I think that can teach us all about some things which we maybe did not realize, which is that a lot of the innovative and adaptive things which we've done in response to COVID in this virtual age of Zoom and all of these other digital things, in moving to that direction, there are people who are excluded by those changes. There are people experiencing homelessness who don't have access to technology to participate in the things that they need to do. There are a lot of people who are part of the working poor and people who are susceptible to falling into homelessness who don't have access to technology and cannot take advantage of the different benefits and things which are made available to them. One particular story that I think kind of sums up my experience with COVID and very specific to Phoenix was a particular day in the middle of the pandemic when this Maricopa County had opened up the socially distanced parking lots, and elected officials and Phoenix police officers and some folks within the different departments within the city of Phoenix collaborated and took that as an opportunity to move people from the easements and install poles and chains. Now, these county parking lots that were opened were parking lots that were designed to, like I said, provide socially distanced spaces for people, whether they were positive or symptomatic or even vulnerable. the goal of opening these parking lots was to create a space for people who really needed the sort of social distancing, which was not available when there were hundreds of people on the easements. But I remember waking up that morning. And being incredibly tired by working almost 2 full-time jobs, cooking and doing the basic services at Andre House, and then my administrative job in the evenings. And I found out that this was happening, and I stood on the corner of 11th Avenue in Jackson, which is where I work, and just watched all of these folks be told, you have to go into the parking lots or you have to go somewhere else. And I'm thinking about some of the things that I've said earlier. People are really struggling. People are going without. Everything is in chaos. Why are we using this as an opportunity to move people? This is why is now the time to move people from the easements and install poles and chains to keep people from ever returning. I was frustrated. I was tired. I was sad. And I sympathize deeply for our guests, because I could never imagine what that would be like. Someone coming up to you and saying you either have to go into a parking lot or you have to just get lost and go somewhere else. When that happened, if this was a normal time, and we know that this year has been anything but normal, we could have instructed people to show up to City Hall and make a comment at the city council meeting about this, or we could have organized large groups of people and advocates, folks who weren't okay with this. But we couldn't do that because all of our city council hearings and all forms of engagement, as far as that's concerned, are now happening virtually, which, to what I said earlier, those things are inaccessible to people who do not have access to technology. I think one of the other frustrating elements of that was that some of the CARES money that we received for supporting people experiencing homelessness was used in that process of installing poles and chains. The way that it was explained was that the process of doing so pushed people away, and in some sense did create more social distancing because people were not camping right next to each other on the easements. I also know that the CDC recommended that cities do not break up encampments at this time, as that could lead to a greater spread of COVID. One of the neat things, though, was that the city of Phoenix did make a great investment in opening up the convention center for heat relief. As I said earlier, in March and April, there was really no significant problem in people being outside, sleeping outside. And then we started the summer, which every year can be deadly for people, or is deadly for people experiencing homelessness. But this summer, now with more people outside than ever before, we were particularly concerned about the heat. So the city of Phoenix opened the convention center to be able to provide weather relief during the day for people who were experiencing homelessness. That, in my mind, was a really great use of some of the CARES money in our city. So I guess in thinking about both of those things, it becomes a challenging thing for people working in homelessness, for folks like myself. On one hand, I was really grateful that the city of Phoenix was investing this money in day relief and providing shade and cooling to people who needed it in the midst of the pandemic. At the same time, I was incredibly frustrated and devastated that the city of Phoenix was using some of its resources to displace people and push people experiencing homelessness out of the easements and to other parts of the city where there were less people who were likely to complain about them and them not having access to a restroom. So what is the balance of that? And what is there to be said about witnessing so closely such meaningful and impactful things and things that are so destructive and harmful? That, in a sense, is the last thing that I really share, and the last point that I would make about what COVID in the city of Phoenix, as someone working with people experiencing homelessness, has taught me. And that is, for the people that we're working with, everything is essential. When the COVID pandemic really started, you saw the separation of essential versus non-essential workers. Things like a haircut were deemed non-essential. And I have a lot of family members, my dad included, who was very frustrated that he could not get a haircut. And between all of us, long hair really isn't a good look for him, so I get it. But things like that were deemed non-essential. Restaurants, non-essential. Libraries, non-essential. Spaces for people to plug their phone and just hang out. Coffee shops were non-essential. We made the right call in closing those things down, but what we didn't think about and what we're left to continue thinking about as we move forward is this ultimate challenge and the goal of my work and what I think we're all called to do, which is to take a step back and spend time with people who are on the streets and understand their lived experiences, or at least try to. We'll never understand. I'll never understand. But in taking a step back and having conversation and getting to know people, that's how we see that our perspectives and what's essential versus what's non-essential, it's such a product of our privilege, of our experiences, of the struggles we do or do not have on any given day. In preparation for this, I spent a little bit of time this week and last week just floating around Andre House and asking people to tell me about what COVID has been like for them. That in itself is a process that I think beyond COVID, we could all make a lot more time for. That is the art of being out with people and asking, how is this impacting you? And what can I do as a person who cares about you to make this day a little less difficult? So I'm just gonna go through some of the things that people have shared with me about COVID, because as I said, before the pandemic, there weren't a whole lot of ways for people on the streets to have a voice. In this digital age, there are even less ways. And I think that as much as we can try and strive to safely spend time with them and understand what they're going to, or like I said, try to understand, the better we will all be at this painfully difficult and challenging and beautiful and inspiring task of trying to end homelessness in the city of Phoenix. Can we pause it? Sorry, the dog is drinking water.
Yeah. All right, we're recording and I'm going to mute my mic now.
So I'm going to spend the last part of my time talking about some of the things that I've learned and the things that people have shared with me. These are folks who are experiencing homelessness in the city of Phoenix. One person, we'll call her Dee, when I asked her about what was the most challenging part of the pandemic for her, she said that what was most difficult was that getting her appointments scheduled was now even harder. I asked her to talk to me a little bit about that, and she gave some really great examples. Dee is someone who goes weekly to her SMI clinic to access some mental health services. Ordinarily, she would come on into Andre House, use a phone, call her insurance, and make sure that her transportation was scheduled to take her to the clinic. She'd wait at Andre House, and then she'd go over to her clinic. Usually when she would get there, they would say it's going to be a little while longer, and she would walk across the street and go into the Dunkin' Donuts and grab a donut and a cup of coffee. She said she'd usually get vanilla frosted, which made me laugh because back when I ate a lot of donuts, that was my favorite as well. She would go in and get a hot coffee and a donut and go back inside and wait for her name to be called for her appointment where she would see her provider every week. Now, her practice of going to access mental health care is much different. There are limited appointments now to reduce the number of people who are in the office at any given time. She's able to go every other week instead of every week, which is inconvenient and both traumatic for her as someone who relies on her routine and someone who depends on the regularity of her schedule. So she goes every week now, and she comes to Andre House still to use the phone and call to make sure that she has transportation. At Andre House, though, our building is not open to people. We're doing all of our services in the parking lot, which means that the lines are longer. People have to wait longer. Sometimes she'll wait 15 minutes just to be able to get the phone and use the phone. Because there are so many people using the phones, sometimes she gets to our phone and our cordless phone is dead when it's her turn. So then she has to find a staff member who's able to give her their phone to use. Normally finding a staff member would be easy, but we don't have as many volunteers right now to protect both our staff, our volunteers, and more importantly, our guests who are more vulnerable. So she has to look around, find someone to use a cell phone. When she gets a phone, she's able to call. She makes her call and she gets to her appointment. And when she gets there, instead of being able to go across the street and wait inside to Dunkin' Donuts, she waits outside and she sits on the sidewalk until it's time for her to be called in for her appointment. In the summer, which was when the pandemic was really bad in Phoenix, Arizona, this meant that she would be sitting on the sidewalk outside of her clinic for sometimes 30 to 40 minutes in 120-degree weather for her biweekly appointment with her mental health provider. Another person that I spoke to, we'll call him E. He was someone who was staying in the parking lots. He was initially excited when a police officer came up to him and said, "We're opening parking lots for you. You can move your stuff inside. There'll be security. There'll be restrooms and access to water." He was ecstatic to go, especially when he found out that it would be socially distant. As an older gentleman with a lot of health conditions, this was a good option for him. He moved into the parking lots, stayed for a couple weeks, and things were going well. But then it became the heat of the summer, and he was in this parking lot without shade or access to air conditioning. He ended up having to be hospitalized for heat stroke and for some kidney failure that was the product of him being dehydrated and not drinking enough water. E is housed now, and he's very happy to be housed, but for him, the worst part of the pandemic was feeling like he was expected to just stay in the parking lots, lay low, and not ask for too much. Those were his exact words. I know that the world is struggling right now. I know that there's a lot of chaos, but I have to just accept that this is how it is because I don't have any other choices. And that made me really sad. You should know, though, that he is still housed. And we have plans to have lasagna together in a couple of weeks or whenever this pandemic slows down a bit and it's safe for him to have company at his new apartment. One last story, and this one is one of the more impactful ones, was that there have been people whom I know, who our guests know, who've passed away in the heat. These were not people who passed away due to COVID. These were not people who were sick before they died. These were people who were struggling with substance abuse, people who were struggling with addiction, people who were struggling with mental illness. And the two people that I'm thinking about, I've known since I first came to Andre House in 2017. There were people who spoke about folks that had died and tried to say, well, they died because of their substance abuse. They died because of their addiction. Their cause of death, as reported by the medical examiner, was an overdose or a suicide. Because of my time at Andre House, I don't accept that. I know there's a lot of us who don't accept that. Maybe those were how these two individuals that I'm thinking about had died. But when I think about the cause of death, I think about one of the very first things I said about my friend who I met in my early stages at Andre House, a person who had been failed by so many systems. these two people who passed away, this pandemic made it harder for them to access the things that they needed. Nationally, we are seeing a trend in people struggling with addiction who are relapsing, because a key part of people addressing their addiction is the community and social support which they come to rely on through groups and through settings where there are other sober people who are around. Because those things have been deemed non-essential services, there are people like the two folks that I know who passed away who are really in the weeds of serious addiction, who cannot go into churches anymore for their meetings. They cannot come into Andre House on Sunday afternoons for their support group because it's not safe for us to have large groups of people in our dining room anymore. I think of those two people and I think of this pandemic. And the last thing I'd say about Phoenix is that the city is unique. I've worked in homelessness in New York and in Boston. Homelessness is very intentionally isolated and concentrated in a particular part of our city, a part of the city that we call the zone. This is where Andre House is. This is where the Human Services campus is. This is where CAST, the shelter, is. This is an area where people experiencing homelessness are allowed to exist because in so many other parts of the city, they are forbidden from doing so. They're trespassing for existing in other places. This pandemic has taught me that separation, that isolation, even as we're encouraged to be socially distant, it only makes it more difficult for the people who are on the streets, so many of whom are struggling with loneliness in ways that I could never imagine. I've learned a lot from COVID and from the pandemic, and I'm more motivated than ever before to work on homelessness in this city, to reduce the stigmatization and the isolation of people who are experiencing homelessness, because a lot of people just don't want folks in their neighborhood who lack a home. I'm more motivated than ever before to spend time with the people that are on the streets, to ask them what they need, what they're struggling with, and what we can do to help them. And I'm also way more motivated to reach out to the people I work with who inspire me every single day. People who since March have been working around the clock in disaster response mode, nonstop, since the pandemic has started. Thank you for allowing me this opportunity to share. I wish everyone safe holidays, good health, and I wish as well that everyone is able to make the time to speak with the folks that you're working with about how they're doing and how this has impacted them. Thank you.